Hey everyone, welcome back to the podcast. So we're going to talk about something very different here today. I've never talked about it on my podcast, but I have had this amazing personal experience with it. So for those of you that listen to me for a while, you know that I've had a long stretch of insomnia. I started taking medicated sleeping pills, prescription sleeping pills, probably 10 years ago, and was very dependent on them. It was down there. It's Ambien, up here at Zopicon. It was a horrible thing. I hated having to take them, but I couldn't sleep. I had severe insomnia. I tried everything natural under the sun, couldn't get rid of it. And 2 years ago in Canada, we legalized marijuana. And I'm not somebody that likes to get stoned, so I went nowhere near it for a very long time. Tried some CBD, didn't work. Finally, someone said, you got to try a little bit of THC. And I was super nervous, but I did it. That was over a year ago, and I have been off all my medication. So I get from many of you listeners complain to me about your insomnia. And not just that, but anxiety, chronic pain. These are things that I hear all the time from all of you, my clients, my members. And CBD and THC, when used correctly, can help with these things. So I have brought in an amazing woman, Dr. Bonni Goldstein. Dr. Goldstein is the medical director of Canna-Centers Wellness and Education, a California-based medical practice devoted to educating patients about the use of cannabis for serious and chronic medical conditions. After years of working in the specialty of pediatric emergency medicine, she developed an interest in the science of medical cannabis after witnessing its beneficial effects in an ill friend. Over the last 13 years, she has evaluated thousands of patients for use of medical cannabis and is recognized as an expert in the clinical application of cannabis therapeutics. She has a special interest in treating children with intractable epilepsy, autism, cancer, and other conditions. Her latest book, Cannabis is Medicine: How Medical Cannabis and CBD Are Healing Everything from Anxiety to Chronic Pain, was published in September 2020. So thank you so much for being here, Dr. Bonni, and welcome to the show.
Thanks so much for having me.
Oh, I really appreciated your book. You should have, I really irritated my family members. So I was like, guess what? Did you know that we have an endocannabinoid system on the inside? And I was just like spewing these facts off to them. You have to try it. You got to try this. I'm telling my neighbor who has a child with a genetic disorder that has seizures monthly. I said, you got to read this book. I said, you're going to listen to the episode after I interview her. She's a pediatrician. So it's really cool that you have so much background in this and that you were a pediatric doctor. So tell us a little bit about how you got into the field of cannabis.
I know it sounds crazy, right?
It
Going from
does.
pediatrics to the cannabis world. But
Yeah.
so what happened, I, always wanted to be a doctor, from childhood on. And I fell in love with pediatrics during my medical school training. I just thought, here's these beautiful little children with lives to live, and here they are sick. So there was just a connection there for me. And I went into pediatrics, and then I trained at Children's Hospital Los Angeles, and they had and I was chief resident there as well. And then I went they had a program there called Critical Care Transport. I was an adrenaline junkie at the time, so I worked in their critical care transport team, which I loved. Wow. I mean, you're actually making a difference, saving children, helping them get from like a small hospital to a large tertiary center and so on. It was very exciting. And then I transitioned to pediatric emergency medicine, which I did for many years, 13, 14 years, something like that. And of course, at the same time as a woman, become a mom, I get married, I become a mom, and I'm burning the candle at all ends, not taking care of me, but taking care of everybody else in my world, my family, my patients. And after a number of years doing that, I got very lucky in that we actually sold a home, and it bought me a little bit of time because we made a little money on it. I was able to get out of my school debt and then have a little money in the bank. And I thought, I'm just going to take a breather and kind of do a reset. And it's interesting. One of the reasons I wanted to do a reset was because a friend was sick. And then during that time, when I took a leave of absence, she started asking me about cannabis as medicine. So remember, here in California, a law was passed in 1996, the Compassionate Use Act, which allowed medical patients with certain conditions, but very open to other conditions. It wasn't very restricted, to use medical cannabis. And I thought, oh, I don't know anything about this, but I'll help her.
Yeah.
Started reading, and I couldn't believe what I was reading, all about the
Yeah.
endocannabinoid system, which only had been discovered like maybe a decade prior to that, and so this is a lot of new information. And we have to remember that we don't know everything about the human body. We're still discovering, right?
Mm-hmm.
And after I just learned about it and I saw her results, I thought, you know what, I'm curious about this. I'm going to continue my journey. And here I am, almost 14 years later.
Wow.
But when I started seeing patients, I just fell in love with the practice.
Wow. Yeah. And it just, reading your book, and I've heard you on podcasts, and I'm just like, it blows my mind that it has taken this long to be legalized, that we are putting cannabis in the same category as alcohol, or worse than that, actually, other drugs, cocaine, heroin. This is
heroin, right? LSD, all of that. And it's punitive in a way, right?
Mhm.
So we've all been kind of brainwashed against cannabis.
We have. Yeah.
And remember, the very important thing to remember is that when it was initially made illegal, or like kind of taken out of the medical category, was 1938, 39, 1940. They didn't even know about the endocannabinoid system. They didn't know what THC was. They hadn't identified most of the compounds in cannabis. So those decisions then were not made on medical or scientific decisions. They were made on kind of political, monetary, societal, racism, all these kinds of things. And then you fast forward, in the 1960s is really when the medical cannabis kind of movement began, because what happened was, people were, quote, smoking pot at concerts and whatnot, but people who had migraines realized, I just don't get as many migraines, or my back pain, I just, or I'm sleeping great, kind of what you talked about earlier. Oh, I started sleeping. And yes, they may have been using it recreationally, but they discovered that, gee, it helps with this and this. And you have to remember that before it was made illegal in 1970, where they really closed the door on it with the Controlled Substance Act, cannabis had been a medicine for 5,000 years.
Right.
And then people came along and just said, no, it's not a medicine anymore. Let's get rid of it. And it really was to get rid of the hemp plant for, again, other reasons, which could be a whole nother podcast. But what I tell people is, look at the science we have today. We're all walking around with little computers in our hands. Did we ever think that would happen? No, we've all progressed. We all accept new things. So I always tell people, just try to take the biases or kind of that brainwashing that we all went through and just set it aside and try to look at the science of it. Because, and additionally, when you look at the millions of people that are benefiting, they're not lying. They pay for this out of pocket. Believe me, parents would much rather go to the CVS pharmacy and pick up their pharmaceutical that's paid for by insurance, rather than spend $500,000, $600,000 a month on medicine that they have to purchase out of pocket, that everybody's given them a hard time about, right?
Right.
So, and why would they continue to use it? Well, because it's what works. It's what they see helping their child or their grandmother or their loved one. So, I just, I try to get everybody to come at this with an open mind. That's why I wrote the book, was to try to just, not necessarily make the case for it, but just put out the information so you can decide without the brainwashing.
Yeah. Yeah. I recently had a client who had insomnia, and she had tried everything. And I said, is it legal to have, to purchase CBD or THC? And she said, yeah. So, I said, maybe you should give that a try. It worked for me. It can work for others. It's worked for many others. I left it at that. I saw her a month later, and I said, so did you try it? She said, no, my husband he wasn't for it. He said I couldn't. And I was like, does your husband drink? She
Yeah.
said, yes. I'm like, that's, ridiculous, really. It's
Right.
always like,
We shouldn't, yeah.
can't compare
We
it,
don't want to
right?
judge one substance against another. They're not the same. They're in different categories. I mean, we know alcohol, even though people might enjoy their glass of wine and whatnot, alcohol has a lot of unwanted side effects, right?
Yeah.
And people die from alcohol, and it causes cancer. And cannabis, and again, and you even said this, when used correctly, and what I say is when used medically, when the goal, remember, the goal is different. When you are a recreational user, if you want to get that, your goal is to get high.
Yeah.
Okay. Same when somebody buys, a bottle of vodka and says, I'm going to drink half of it tonight. They want to get drunk. Okay. We allow adults to do that. Many states now allow adults to use cannabis for the same end story. But when used medically, what is the goal? The goal is wellness, a decrease in symptoms, an improvement in quality of life. The goal is not to be altered. And this is what I tell everybody is my patients that I see already have a boulder sitting in that pathway of life. They don't want to add being stoned or cannabis
No.
dependence on top of it. We want to roll the big boulder out of the way so that we can move forward. And when I say that, the boulder's still there, it just becomes manageable. Yeah. And I think that is something that a lot of people connect with is when your medical conditions are controlling you, you feel out of control, you feel like that boulder is there. When you are controlling your medical conditions by using cannabis as the tool that it is, you now have power over your own life. So I see children who, when they come to me, they're not able to go to school. Guess what? We get them back in school. Now, they can't be in school intoxicated. They're not intoxicated. So I want to make sure that people understand there's a big difference between recreational adult use, which, like I say, have at it, go right ahead. Just don't drive your car.
Yeah.
Okay. Right. But the same thing with alcohol. You want to do that, have at it, don't drive your car. And again, for adults. But when we're talking about patients, what we're talking about is controlled use with a defined outcome. I'm going to get your pain from an 8 out of 10 down to a 2 out of 10. That's the goal. I'm going to get you to sleep 5 or 6 nights out of the week. I can't promise 7, but maybe we can get there, right? And remember that it's just, it has to be separated the same way we separate people who kind of, are using opiates inappropriately versus the person who really truly gets a benefit from an opiate, where they find they can get up and go to work because of that, little opiate pill in the morning, right?
Yeah.
We have to separate it because that's the only way for us to move forward. So again, under medical supervision or when used medically, what a great tool. And I'll just tell you, Karen, my husband jokes around. If you've heard me on other podcasts, you may have heard me say this. I am a chicken in a mommy suit. That's what he calls me. If you unzip me, there is a chicken inside. I'm very conservative physician. I just kind of found myself in this cannabis world.
Yeah.
But again, to me, it's just another tool.
Yeah.
It's a tool in the toolbox. It's a medicine when used medically. So
and
that's
medicine
why I always tell
that's
people,
underused and underappreciated, I think, in our work, in our medical system.
Well, I think because the whole kind of stoner, the way the media portrays cannabis, like, when you think of Cheech and Chong and you think about stoners and whatnot, there was a survey of elderly people who use cannabis and asked them why, did you tell your doctor? And a huge percentage did not tell their doctor. When asked why, I don't want my doctor to think I'm a pothead. And that makes me so sad because your doctor, one, should be your partner and should be you're advocating for your own health and they're there to help you achieve wellness and a quality of life. And yet you're afraid to talk to them about this because we've all been brainwashed.
Yes. Yeah. So let's get into then the science of it.
Absolutely.
If possible, let's dummy it right down and let's talk about what is the endocannabinoid system and how does that differentiate from taking it? Yeah, you explain it.
Sure. So the endocannabinoid system is the best way to describe it, a physiologic, meaning within your body, regulator of kind of like the balancing act of the messages that your cells send. So think about a cell, And let's say it's a cell in the part of my brain that controls nausea and vomiting. And it's sending a message to feel nausea because I just got some medicine. Like, let's say I have cancer and I got chemotherapy. My brain says, ugh, poison. And I feel nauseous and I have the urge to vomit. Okay. That's part of my brain sending a message. When that message is sent, if it's an over message, so think about that, too much message, we have a system, the endocannabinoid system, that makes little compounds, what I call our inner cannabis, endo for within, cannabinoid, cannabis, inner cannabis compounds that are released that kind of go back to the cell and say, stop, dampen it down, stop sending the message. There's a movie that came out of Israel where they show this poor man who's suffering terribly from cancer and chemotherapy, and he won't eat and he's wasting away, and his family doesn't want him to have cannabis. But they finally relent. He takes a puff, and like 4 minutes later, you see him eating a sandwich. Now, how is that possible? THC in the plant is substituting for his inner cannabis, and it's telling his brain, dampen down that message of nausea and vomiting. And the way it works is the compound, whether it's your inner cannabis or the THC, sticks on to a receptor, which is like a lock. So you have a key, which is the cannabis compound, and a lock on the cell, and they stick together, and it tells the cell, change your message. So where are these receptors located? Well, it turns out that it's the most widespread receptor system in your brain. Now think about that.
That's crazy.
Why are doctors ignoring it?
Yeah.
It's all over our brains. And you know what drives me crazy is doctors will often tell women, especially male doctors, it's in your head. And I always joke around, yes, it's in my head. It's my endocannabinoid system. It's not me making up my symptoms, because this receptor system, the endocannabinoid system, controls emotion, sleep, appetite, your metabolic system, whether you gain weight, lose weight, everything kind of related to energy metabolism, weight loss, weight gain. We know babies, turns out animals that don't suckle have a problem in their endocannabinoid system with failure to thrive.
Oh.
Okay. I mean, it's very fascinating, right? It
Yes.
regulates eating and appetite. Mood, I already said emotion. So nausea, vomiting, motor control, memory and fear. This is why we see people with PTSD have a very nice result with cannabis, because it helps dampen down that message of fear and hypervigilance and anxiety. So when you think about like who we are and what we do, our endocannabinoid system is kind of working really hard to keep us in balance. When there's over message, it pulls it back. And conversely, if there's an under message, it brings it up. Now, not only is it located in your brain, it's located densely in your gut and in your immune system. So think about that: brain, gut, immune system. That controls just about everything that we do, right?
Yes.
And I know you know about this, right? Because when we think about a lot of issues that people have, they kind of all relate. Like when you don't feel well, digestion is out, right? You can be have low immunity, right? All of these things kind of, and then we have anxiety and depression. They all interrelate. And what's interesting is, you know, even my own attorney had said to me, how can it treat so many things? The receptors are not just, like I said, in your brain, but gut immune, but also in many other places. And I outline it in the book, in your heart, in your liver, in your reproductive organs. Out of Israel, you know, Israel is doing a huge amount of research on cannabis, which is fantastic.
Interesting. Yeah.
And what they tell us is that all this research is telling us is it's involved in almost every physiologic system in your body. That's a very strong statement. It means that you cannot ignore it. And what I tell people who are chronically ill, like, you know, I know people who for like 10 years have been trying to find the answer. I know you do too, right?
Mm-hmm.
You meet people who are struggling, and they go to this doctor, they tried this medicine, and then they tried this and that. And they're even thinking out of the box with all the alternative and complementary things. And they just can't get there. And I say, don't ignore your endocannabinoid system, because it turns out chronic stress, chronic sleep deprivation, poor diet, not enough exercise, kind of like a lot of chaos. That's going to tip your endocannabinoid system out of balance. And you may not be able to get it back into balance unless you augment the system with the plant compounds. And again, you don't have to be intoxicated. That's a very important part of this, is intoxication does not have to be part of using cannabis as medicine.
So when somebody takes it, like myself, and has what I feel like I have very sensitive to it, a very small amount. And I, many times in my, trying to find the right dosing for my sleep, I've taken too much and I instantly get super it gives me the opposite effect where I can't sleep. I've got anxiety. I've got the fear. My head's ruminating. Is that because I have enough? Like I have a strong endocannabinoid system, or no? Like I'm putting too much?
Right. Sure. Right. Well, I would say it's dosing. That's a dosing issue. It's a fine line between finding the sweet spot, not taking enough, finding the sweet spot, or taking too much.
Mm-hmm.
So we have a saying, start low and go slow. But the beauty of the current kind of world we live in now is that you can find cannabis that actually is labeled. You can figure out your dosing. So what I tell people with THC, so an adult dose of THC, we usually recommend start with 2.5 milligrams. That's just kind of where it fell. Okay. But in somebody who's super sensitive, hasn't used it before, is nervous about it, I start people at a 0.5 milligram.
Right.
Right.
Yeah. So low.
Much lower, like a fifth of the dose that's recommended. Why? Because there are people that are sensitive, and a 0.5 milligram might work. Then I go to 1 milligram, and then I tell people try 1.5 milligram, then try 2. Like you tiptoe up if you are concerned or nervous about it. The other way to kind of minimize any of that too much message, right? When you take too much, it's too much message, is to balance it with CBD. So there are many products out there that come in a 1-to-1 ratio, and studies tell us that THC binds to that receptor, okay, like a key in a lock, and sends that message to the cell. Change your message. So if you're having anxiety, turn down anxiety. If you're having nausea, turn down nausea. If you're having seizures, back up on seizures. Okay. When CBD is in the mix, CBD kind of sticks to the side of the receptor. If that makes any sense, like a different site on the receptor, and tells the receptor to change a little bit. Don't let the THC stick so tightly. So you can actually balance it a little bit and kind of take the edge off. And what we know is that just from reports from people, in a 1-to-1 ratio, half CBD, half THC, you can still get the benefits of THC, but that CBD helps to block some of the unwanted potential side effects. Not everybody gets those side effects. And when somebody says to me, oh, am I taking a big dose? What I always tell people is you take the dose that works. Sometimes you have to pass up the dose and go, oh, no, that's not it. Let me go back to know that that's your sweet spot, right? How do you know that that's your sweet spot if you didn't sometimes tiptoe past? But the reassuring thing is that there is no danger. Everything will, it's just a matter of time. It will wear off, as you've probably figured out. And the way to do it is, one, be patient. I once had a patient who was in terrible pain, and he went right from my office straight to the shop, bought his cannabis, and went home and took like 7 different things. And I was like, I understand you're desperate for help, but now we have no idea what worked, what didn't work, what made you paranoid and anxious, what made you too sleepy. So you have to be a little methodical if you're new to it. And in my book, there's a little chapter on kind of think about how to begin, what sounds good to you. And I like tincture drops, basically. They're it's a liquid form, because you can really titrate the dose. If you eat a piece of a brownie, hey, it might say 5 milligrams, but remember, when you eat it, it goes into your gut and then it goes to your liver, and your liver alters it and can actually make it stronger. So you have to be very careful. A lot of elderly patients say, oh, they think maybe I might tell them to smoke it, which I wouldn't, but they think about, oh, I like the idea of eating it in a cookie or something. But really, the drops under the tongue when you are new is a very nice way to go, because you can really regulate. And that's what I do in my pediatric patients. They're always using liquid. It's occasionally edibles, occasionally some topical and that kind of thing, but mostly in what we call a tincture form. Be aware, a tincture by definition means there's alcohol. Most products don't have alcohol. Some do. It can enhance absorption, but you really don't want a lot of alcohol, certainly not for children. An extract is more of the definition with oil, but we kind of interchange extract and tincture in the cannabis world. And all it means is it comes in a bottle.
Yeah.
And
I
so
find it's most
that-
cost
yeah.
effective. that way.
Probably, absolutely, yes. And when you put it, you should hold it under your tongue. I usually tell people at least 30 seconds, but if longer is better. We also know you should take it with food. You absorb more when you take it with some food, especially with food that contains fat, because these compounds actually are what we call fatty acids. They are fat. Fat mixes with fat well, and you can absorb it a little bit better that way. But remember too, there's other ratios. So you might see something like 25 parts CBD to 1 part THC on the market, right?
Yeah.
And then you say, well, I don't even know what that is. So that just means there's 25 times more CBD than THC. That's really going to kind of dampen down that THC effect. You're not really going to feel the THC. That's kind of the ratio I start with children who have epilepsy, right?
Okay.
Because we're really looking for more of a CBD effect. But we have found, and the studies back this up, that a little THC in the mix, even if you don't feel it, it works better. And why? Because that receptor in a sick person that little tap at the receptor from the THC helps that endocannabinoid system kind of function better. And remember, what's the goal of the endocannabinoid system? Why do you have it? To balance those messages.
Right.
So if you tip in one direction of illness, it helps get it like rights the boat. That's the analogy I like. You're a boat on the ocean and this big wave comes and tips you, illness, inflammation, something like that, and your endocannabinoid system goes like this. And if it needs a little help, right, you use the cannabinoid compounds from the plant to help augment that endocannabinoid system. And for some people, tiny doses work. Other people need much larger doses. And again, there is no one size fits all. And I talk about that in the book a lot. I'm sure you probably got tired of reading that, but
no, I liked it.
It is so important that you listen to your body.
Mm-hmm.
And when you say, if you say it's not working, you probably haven't taken enough. There are people who need, like, you're sensitive to it. A low dose helps you. Somebody else might say, I took 5 milligrams, didn't do anything. Okay, go to 6, go to 7, go to 8, go to 10. I hear a lot of people saying with CBD, oh, it didn't do anything for me. I said, well, how much did you take? Oh, I just took a few drops. Okay,
Yeah.
well, okay. You wouldn't crush an aspirin and take a speck for your migraine. So it's very important to make sure if you're taking a dose that your body kind of sees as a dose, you should feel something, whether
Right.
it's less anxiety, whether it's feeling sedated, whether it's feeling less pain, about all of a sudden, like I have a lot of moms who say to me, I'm a better mother. I'm a better wife because I'm
Yeah.
just not so, and look, we women, man, we're tough. We handle it all,
We do.
And we do everything for everybody.
Yeah.
And sometimes, we don't do self-care. And part of that stressor kind of tips that endocannabinoid system where now you're a little depleted and you do have to, go back in. And I think for, you started talking about, sleep when you started off the podcast. That's such a huge thing for so many people.
Oh, it's so big.
Right. Because when you get a good night's sleep, the whole next day, you just feel like, boom, I'm going to take on this day. And what I tell everybody is whatever you take at 8, 9, 10 o'clock at night, the night before with cannabis, that will be gone by morning. So you don't have to worry about that hangover effect. And I tell everybody, if you have a hangover in the morning, it's from the cannabis. It's one of two things. You took it too late or you took too much.
Yes.
Easy.
Yeah.
Change your timing, change your dosing, play with it. One of the things I tell everybody is cannabis is the most flexible medicine you will ever meet in your life. There is no rigidity to it. You can skip days, you can take extra, you can change up the timing. Listen to your body. I always tell everybody, journal it in the beginning to see, oh, let me look back. Oh, you know what? I slept 4 nights in a row with that dose and that product. Let me revisit that, right?
Yeah.
So it's very important. And in a way, I always tell people it may not be as easy as just popping a pill, but
No,
you
yeah.
also don't get the side effects. You also
Yeah.
don't get organ damage. You also don't get any of kind of these, we're hearing about drugs that people have been taking, let's say for acid reflux, that now it turns out years and years later, we're finding out they cause dementia. Okay, I don't want to be the guinea pig for the pill that they don't know what it does yet. When I'm 90, I don't want to find out that pill I took in my 50s caused whatever issue, right?
Yeah.
And we have a lot of that going on. So cannabis just doesn't seem to do that. And by the way, what we're seeing is that the cannabinoid compounds, the main thing that everybody should understand is they're anti-inflammatory. Think about all of the chronic illnesses, right? They all kind of relate back to inflammation. And one of the other things is insulin resistance. It's a big deal.
Huge,
right? And when you look at many of like neurodegenerative conditions like dementia, whatnot, insulin resistance is kind of part and parcel of it all. And we know that cannabinoids help with energy metabolism and lowering insulin resistance. Very protective.
Very interesting.
And there's not a lot of medicines out there that have these other protective qualities. Like when we take a pharmaceutical, it has a target, right? And that's the target. And you don't get a lot of other perks. But with cannabis, you get some of these other perks. I'm taking an antioxidant. It's an anti-inflammatory. Yes, okay, it's helping my pain, but it's also doing all of these other things behind the scene. And that's, again, Mother Nature grown. It's like, I joke around. It should be a little
She's a smart cookie, that Mother Nature.
Yes. Listen to her.
Yes.
When we're all walking around with our green smoothies, throwing a little some cannabis leaves in there would be okay. And remember, you cannot get intoxicated from or impaired from the raw compounds from cannabis. I have started using the raw cannabis compounds. Remember, when you heat, like, why do people light it on fire? Because it converts from the raw to the heated up version, which is the THC. Right. To get CBD, you have to heat it up. Well, we used to think the raw compounds weren't biologically active or had effects. They're potent anti-inflammatories. They're potent anti-cancer compounds.
These are the THCA.
Is one of them. And CBDA.
And CBDA, and I have it written down. One of THCV suppresses appetite and reduces fasting glucose. THCA inhibits prostaglandins, which can be very inflammatory, can be part of endometriosis, things like that. So the stuff that we're getting off the market that's just saying it's THC and CBD, do they have the raw compounds in it, or do you actually have to see it that
it should say so? Right. So remember, I'm in California where, like, we've been doing this a long time. We have a lot of compounds on the market. Same thing in Colorado, Washington State, maybe Oregon. If something is labeled THCA, by definition, they basically packaged it up, like processed the plant into an oil without heating it.
Okay.
And in order to maintain its integrity as an unheated compound, you would keep it refrigerated. It doesn't have any intoxicating effects. Now, there's going to be a tiny bit of THC in every THCA product, just because THCA with heat and light and just being cut off the plant will convert a little bit. But, if you left it in your car on a day like 108 degrees, it might convert and get very hot, and the THCA would convert to THC. But in general, when you get it packaged up as a raw, now sometimes it comes in like a crystal form, but I recommend always using the tincture THCA and CBDA. CBDA wasn't really available until just a few years ago, and now I'm seeing some really tremendous results, especially for pain and inflammation. I'll share with you. So I have a patient who's been my patient for many, many years. And yes, I have a specialty in pediatrics, but I still have a few adult patients left over from when I first started doing this, and been with me for so long. And this is a lovely older gentleman, and he takes a little cannabis kind of for wellness, for some chronic back pain, but he must have done something with his diet, and he started getting gout symptoms. And gout is when you have a buildup of uric acid and it kind of clogs up your joints, and it is painful. It feels like someone smacked you with a sledgehammer on your toes. Okay. And he kind of doctor shopped, and then he thought, oh, you know what? Let me give Dr. Bonni a call. And so we chit chatted, and I said, you know what? And I don't want him intoxicated. He's going to be like, he's 89 years old. If he gets intoxicated and he falls, that would be a disaster. So
Yeah.
CBDA has 0 intoxicating effects. And I put him on, I said, let's try CBDA. And we started at around like 25 milligrams, and he titrated up. And his gout, he said, within 2 weeks, he had 0 gout pain. And he had seen multiple doctors and had just been prescribed opiates. They just kept giving him, pain pills. And he's an older guy. And he said, I don't like the way they make me feel. They make me constipated and loopy. And I don't want, and he actually said to me, this is not a way to, like, at the end of life, to be suffering with gout. He goes, it just wouldn't go away with the conventional. CBDA did the trick for him. And I always tell people, I can't promise it'll work for everybody else, but why wouldn't you consider it? It's natural.
Yeah.
What do you got to lose?
You had a client in your book who, I think it was the THCA, if I remember correctly, you got rid of her migraines. And I was like, ooh, I want to try that.
Yes.
So I get migraines.
I think you're talking about the a patient who she had Hashimoto's thyroiditis. She had been diagnosed with irritable bowel. She had some anxiety and depression, and lots of other things, including these crazy migraines, like 3 times a week, where like she literally had to stop. And so like it totally affected her ability to parent, to work, to travel, to be part of her, to participate in her life.
Yeah.
And we had started off with some 25-1, and it just didn't. We ramped up the dose, because remember, if you're not getting the effects, you got to try a higher dose. Just didn't do the trick for her. She was terrified of THC. Right. And I convinced her to try a lower ratio, 4 part CBD to 1 part THC. Started very baby doses. And like I told her, you tiptoe up as you see fit. And boy, she did great with that. And then when we added in the raw cannabis compounds, that helped her sleep. Anxiety and depression was the THC CBD THC 4-to-1 ratio. But then when she added in the raw cannabinoids, that's when the migraines disappeared. And I have to say that. Yeah, it's very hard to know which person's going to respond to what.
Yeah.
In the mix. And that's why, again, journaling and then being open to all the compounds. So right now I mostly use five different compounds, because those are the ones that are most readily available. So of course, THC, and remember, THC has what we call a narrow window of dosing. So 1 milligram for most people, and most new patients, they're not going to take any more than 10 or 15 milligrams. I mean, you're going to find your dose pretty quickly. That doesn't take long if you're going up little by little. Just give yourself a couple of weeks and you'll find your dose. I use CBD. Now, CBD, of course, has and I explain this in the book, a very wide range of dosing, meaning some people do well at 10, 20 milligrams, and other people need 400. The highest dose I've had anybody on is probably a young man right now who has epilepsy, who went from, like, it's a 99% reduction in seizures. In fact, he went 3 years without a seizure. After, years of having seizures and medicines not working. He's on 1,600 milligrams a day, which is very expensive.
I was going to say that must cost a fortune.
Right. But they have a supplier who is very nice to them, gives them a very significant discount. But why does he need so much? Well, he's a young adult. He's a big sized person. And for epilepsy, we do kind of go by weight. You need to have enough, and because that's been studied and we know. But doing great. So can humans tolerate huge doses? Yes, there was even a study where they give like 6,000 milligrams and there really wasn't any downside. What people ask, well, what is the downside to CBD? Well, for some people, it makes them feel weird. Then it's just not for you. That's all.
I did hear if too high amounts could give you a headache. Do you find that?
Well, I haven't seen that too much. What I've seen is sedation. So CBD is really interesting. In lower doses, it can be almost alerting for some people, kind of uplifting. So some people say, if I take 10 milligrams, I can't go to sleep. But again, that's like an individual thing, because we all know people who can't drink caffeine after 3 o'clock in the afternoon, right? And then I know people can have a cup of, espresso at 10 o'clock at night and then go lay down. I mean, that's not me, but I could never either. But there are people who can. So you just listen to your body and see, whether or not you can take it late in the day. But some people do well at that low dose. Higher doses of CBD can cause sedation, which again, for some people, if
You may
they
want
tell me low
that.
doses didn't help with sleep, dial it up, see
Mhm.
what a higher dose does for you. And then in the studies on children with epilepsy, because that's really where it's been mostly studied, there can be decreased appetite with higher doses. There can be some GI upset, diarrhea. It's not, I just don't see a lot of that in my
Yeah.
patient group because most people aren't taking mega high doses, right?
Yeah.
Again, because they're very expensive to sustain over time. But so THC, and again, for THC, the side effect is mostly you can feel uncomfortable, what we call a dysphoria. It's just too much. I'm feeling impaired and intoxicated. I don't like it. I don't want to be stoned,
Yeah.
right? Now, for some people, they'll find that like 5 milligrams might make them a little loopy, but boy, that's what gets them a good night's sleep. So some of my patients will take it, go lay down, and it kind of kicks in, but then they sleep through those effects. And it just
Yes.
has that sedating effect. And so they kind of are like, well, maybe I felt it a little bit as I was drifting off to sleep, but I wasn't uncomfortable because I was sleeping. I was very relaxed and it just helped me sleep. The other compounds I use like with the raw, so THCA and CBDA, and those are mostly for people with pain in the general population, pain, inflammation. Both of these compounds are terrific in lower doses in my experience, for nausea.
Okay.
So people who have any kind of, maybe you're taking a medicine that you have to take for another condition, but it causes a side effect of nausea, a little bit low dose. CBDA or THCA can really help with nausea and vomiting and again, inflammatory conditions. In my, specific demographic of children, I've seen THCA be very helpful for children with autism.
Oh,
And remember,
interesting.
there's a little tiny bit of THC in there, so we don't always know which compound's doing what.
Right.
So I can't attribute always to THCA, but there's no reason not to try THCA because it can be very helpful. And what's interesting too, THCA and CBD are absorbed better by the body. So that may be why lower doses work a little bit better. Then you don't need as high doses like with CBD.
Yeah.
Then the other compound I work with a lot is CBG. CBG stands for cannabigerol. And CBG wasn't really available on the market till just very recently. And it's not intoxicating. And it seems to help with inflammation, anxiety, depression. It's anti-cancer. In a recent study just came out showing some really interesting anti-cancer effects. One thing I want to share with everybody is we don't know everything about these compounds because we are prohibited in the United States from studying them. Thank goodness Canada legalized. So at least the scientists, doctors, researchers can start doing really meaningful research. We're behind the 8 ball on the research.
Yeah.
We've lost about 80 years, right?
Wow.
So when people say, well, can it do this? I said, well, it might do that. But if it hasn't been studied, like I was reading recently about how cannabis can help with like hormones, right?
Yeah.
So there's a study that shows that it can help lower cortisol, which is like your stress hormone, right?
Yeah.
But the study's from 1993.
Right.
Like, how about something in the last decade? Can we study that, please?
I interviewed Dr. Anthony J, who wrote the Estrogeneration book, and he said marijuana is a phytoestrogen. Have you heard of that?
Yeah.
Yeah. So,
well, yeah, I mean, and again, we don't know everything about it. And so I always tell people, if I tell you, look, there's one study that shows X, the next 10 studies may show the opposite of that. So again, look, in general, cannabis is extraordinarily safe, again, especially under medical supervision, especially when you're paying attention, you actually care about milligram dosing. You're not just, hey, I'm lighting up and going for it, right? Even then it's pretty safe. But at the same time, when we're dealing with chronic illness, medically complex situations, you want to know about the tools that you're using. And so I am so eager when like new papers get published because it's just information and the good news is it's coming down the highway pretty quick. Last year, 2020, there were more papers published on cannabis than ever before. And so maybe that's because
Wow.
everybody's sitting around at home for COVID, writing away and typing up their articles, and they weren't out, enjoying the beach or whatever. But it just, there's just a lot of interest. And I think we haven't really even scratched the surface of what it can do,
Yeah.
because long-term studies would be nice, right?
Yeah.
And
Yeah.
again, when you look back at the long-term studies that they've done, they only looked at recreational, uncontrolled people just basically using THC in a very non-medical way. And that doesn't help me, because that's not how
Yeah.
I recommend it or how I want people to use it. So to tell me that, oh, it can create more anxiety, well, I would never leave a 15-year-old in charge of their medication, right? In terms
Yeah.
of, okay, you have anxiety, here's the keys to the pharmacy, go pick something out and have at it, right?
Yeah.
That's what's happening when somebody is self-medicating without knowing what they're doing. When
Yeah.
they think they know, because they know, oh, sativa indica, they know like 2 words. That is not knowing
CBD,
how to
THC.
use,
That's it.
right. You're, if you haven't learned about it and studied it, you really shouldn't be, quote, self-medicating, especially as a teenager, right? So when they study teenagers and say, oh, it can do this, this, and this, that does not equal, a 15-year-old with epilepsy and autism who I'm treating, because I wouldn't treat them the way somebody, a 15-year-old might, a healthy 15-year-old might medicate, right?
Yeah.
Does that make
Yeah.
sense,
Yeah.
right? It's
Oh,
not
yeah.
this, they're not equivalents.
Yeah.
You
Yeah.
know, if I
Exactly.
diagnosed you with pneumonia, I wouldn't say, okay, go pick your antibiotic. You'd be like, no, well, tell
No.
me, I need you to help me with that. Right.
Yeah.
That's a medical thing.
Yeah.
So, I find a lot of those studies from the 70s and 80s. And again, that was the whole, dare to say no, and, or, just say no, all of that kind of coming from that whole drug war thing. That's not helpful in a medical situation.
Yeah.
That doesn't
Yeah.
help me at all. So
No,
that's why we need to deschedule cannabis in the United States,
absolutely.
legalize it for research, and because again, it's interesting, we're putting the cart before the horse a bit, because we are treating patients, and again, very safe medicine, especially when medically supervised. But let us research it. Let us know more.
Yeah. It's strange that they're not letting you research it, but you can prescribe it. It's very backwards.
100% odd,
Mhm.
right? And it's funny, in Israel, like everybody's researching it, but they are very limited on who can get it. They still have a lot of patients that use it, but you're very limited on in terms of which patients can get it. So
So
if
it's
you don't
not legal
have,
over there.
it's not legal. You have to be approved by their Ministry of Health
Mhm.
because you have a certain condition. So
Yeah.
like cancer patients, they're starting to open up a bit. Epilepsy, children with epilepsy, they're doing research. They're doing clinical trials on autism. I would love to do a
Wow.
clinical trial on children with autism with cannabis here. I'm not allowed to. That drives me crazy.
Yeah.
Because again, isn't it about, helping these families, helping ill people get the best quality of life? I don't want people to have to wait another 50 years for information. Let's do it
No.
now.
I'm
Yeah.
sure you guys are right behind us, though. If we've taken the initiative, we've legalized it here in Canada, the United States is going to see how great it's been, hopefully, and all the research that we're doing on it. And then hopefully the United States will follow suit. But it is legal in California or no? Like to
Yes, we
buy
have
as
2
a,
tiers.
okay.
Yep, we have a medical tier, right? So you can still see a doctor, get a letter, go to a dispensary and purchase your cannabis. Or if you're over 21, you can go to certain places that are licensed to sell what they call adult use cannabis. You can go there and purchase your they're somewhat restricted in terms of quantity and all of that, but and there's a lot of now, um, everything's required to be tested. Before 2018 here in California, we called it the Wild West, because you did not know what you were getting. And like, look, I take care of children. I
Yeah.
made friends with a laboratory and I said, will you test stuff for me? I treat children. I need to have it tested. And they're so nice. They test a lot of stuff for us so that we know what these kids are getting. It's a deal breaker. You can't
Yeah.
just go buy something and not know that the label on it is correct. So now that we've had the laws change in 2018 here in California, everything's changed about in terms of when you go into a dispensary, you can be assured that everything's been tested at least twice
Yeah.
and is on the market because it passed the strict criteria. So not contaminated and And
Yeah, because you were
it
said in
is,
your book it could have heavy metals, it could have pesticides in it. And so after I read that in your book, I was on the Canada site going, has the marijuana in Canada been tested for all these things? And sure enough, it had
right.
been. So that was good.
Sure. And here in the United States, different states have different criteria, like, you know, X amount of pesticide is allowed, or this isn't allowed. So at least there is some, and some states are stricter than others, but at least you know that it's tested and it's close, you know, it's close to what's on the label. Whereas prior to that, those regulations being put into place, it was buyer beware. And I do want to put out there that the unregulated hemp market is still buyer beware.
Okay.
Okay. Because
Good
what
to
you can
know.
buy online, you know, I just today got an email from a mom, 3 links. She said, are any of these, do you know of any of these companies? And I looked and I said, they all look very lovely, but until I have that, what's called the certificate of analysis in my hot little hands, I can't tell you anything. They can put anything they want on the label. They can make whatever claims they want, which is not really supposed to, but they can. I want the test. And if we're still for a child, I get it third party independent testing, because,
Wow. Yeah.
you know, there's
That's
people
good.
doing this to make a buck, and they may not understand that the end user might be a sick child or a sick elderly person. And, you know, it's do no harm at all costs there. So we just double check everything with that lab. And look, when we have partners like this and taking care of people, it makes it easier. So anybody listening out there, always ask for what's called a COA, certificate of analysis. And if somebody says, oh, it's proprietary or we don't have it, move on to the next. All the companies that are good are transparent. In fact, they'll have like a QR code on their bottle, and you can just point your phone and get the certificate of analysis. You want that. That's
Okay.
information for you.
Yep. Excellent. Excellent advice. Oh, we could just go on and on. I've got so many questions, but I think that's great. I think that's a great place to stop, because your book, we have to, you know, leave people to go read your book now and get more information if they so care to read more about it. Because your book really does outline all the different things that you can use it for. And there's a very long list, everybody. It's not just these little things that we're talking about today. Well, they're big things: anxiety, insomnia, epilepsy, all of these things are
Chronic
huge.
pain.
Chronic pain. But there's more to it than that. Like you said, there's half the things I don't even know if we know yet. So it made me happy, because taking it, I was immediately worried, going, well, it's got to be better than a sleeping medication, which I went,
No question.
right. I had to come off that,
No
because that can
question.
lead to dementia. But then I was like, but I've heard that THC can cause memory problems. And you cleared that up. There wasn't, right? There wasn't any connection
It
with that.
can, but it's usually kind of with overuse. And so
Right,
people
right.
who take the dose that gives them the medical result that they're looking for, and you don't take more than that, you're very unlikely to experience side effects.
Yeah, it was quite safe. Like there wasn't anything on the liver. It was
No.
like, it just made me feel so good. I'm like, I'm not only just getting my sleep out of it, which is huge, but I'm doing other things for my body, right?
Anti-inflammatory, antioxidant, anti-cancer effects. And I always tell people, like, and you can't necessarily measure that, but like if you said to me after a month of using it that you're feeling terrific, you listen to your body. What could it possibly be doing? You know, a lot of people say, how do you give it to children? Oh my gosh. And I say, these are kids. Like I have a story in the book, you probably remember, a little girl who came to me at 9, and because of her epilepsy and all the drugs she took, she didn't read or write.
Yeah.
When she started cannabis, she learned to read and write on cannabis. Tell me how that's holding her back. What it did was it helped make connections. It controlled the epilepsy. It allowed her brain to move forward.
Wow.
And I always tell people, talk to the people who use it medically. They will share with you. And by the way, there's some really great research coming out of Canada. A doctor by the name of Dr. Mark Ware, who is in the book, you know, his papers are all over the book, but also a Dr. Stacy Gruber at McLean University here in affiliated with Harvard. She's actually doing research on what does medical cannabis do to you? So she gets people before they start it. Test them. She says they're the most tested people on earth. They have MRIs and CAT scans and memory tests and psychological testing. And then she follows them. And what she found was that they had improved neurocognitive functioning. after just
Wow.
3 months.
And you would think
Now, is
just
that
the opposite.
well, because that we've been brainwashed.
Yes.
That's-
Oh,
we're all thinking about the stoner, but we're not thinking about the medical user. That's the person who is benefiting from this.
wow. Yeah, that's, you're doing amazing work. Do you actually take clients right now?
So right now I am so overwhelmed.
I'm
I am
sure.
actually looking for any physicians out there that want to learn. Please reach out to me. I am desperate to find people to educate and teach. So, because as a one person doing this, I do have colleagues out there who do this who are wonderful, but there's only not very many of us, and there needs to be more acceptance within the medical community. But when you have a challenging condition, you want to have a physician who really knows about this.
Yeah.
And so I always tell people, like right now, my practice is full, but I'm really very happy to educate physicians and help physicians kind of move along to you get this tool in their toolbox, because it needs to just be out there as an option on the table,
Yes.
especially for those who haven't found the answer yet.
Yes, exactly. Oh, well, thank you so much, Dr. Bonni. I really appreciate you coming on the show. It was so eye-opening. I know all my listeners are going to be fascinated by this conversation. So thank you so much.
Happy to come back anytime. Thank you so much.